Good afternoon. Welcome to the Sunday Daily Briefing for day 247 at the EMA office. Joined here today with the Chairman, Mark Kern, and today the Director of the St. Clair County Health Department, Barb Holt. Barb, welcome.
Hello, welcome. Day 247, like Herb said, and it seems like Groundhog Day every day over and over, but we're working very hard to offer testing to staff and to the general public and to everyone, offering up more and more test sites as we can get those. So I'll talk about all the test sites in just a minute. Results of some of those test sites include a total in St. Clair County. We have tested since first part of February, 133,683. So for today, that's an increase of 975 tests. Of those 975, 145 were positive for COVID. Both males and females from under 1 year of age to into their 90s. That makes a total of 11,572 that have tested positive. And with those 145 for today, it's a daily positivity rate of 14.9%, which is very high and makes our 7-day rolling average in St. Clair County 15%. Total deaths, unfortunately, we have one new death to add to COVID-related deaths in St. Clair County. This is a male in his 70s, and he had unknown health conditions, so that makes our total of 234 deaths in St. Clair County. Our deepest sympathy goes out to that individual as well as the others that have died due to COVID-related illness. 9,552 folks have completed their 10-day required isolation in St. Clair County. Statewide, we have huge numbers again. Total, they have tested 9,070,841 folks. Of those, 573,616 were positive. For today, they had 10,631 positive. And unfortunately, we had a large number of deaths statewide of 72. This might be the highest statewide death we have had. We'll have to check that, but that's an awful lot. Total deaths in the state, 10,742. And again, our sympathy goes out to all of those family members. Hospitalization numbers in St. Clair County. Again, we have 91 COVID-related patients in the hospitals in St. Clair County, and of those 91, 6 are on ventilators. Region-wise, we have 201 COVID-related illness patients that are hospitalized, and of those 201, 18 are on ventilators. Today, as far as our long-term care and congregate settings, we have one additional case at Mercy Rehab Care Center in Swansea for a total of 26 cases and no deaths. Again, as I said earlier, we have several testing sites that are available. This weekend, we were at Belleville West High School and had huge crowds. Yesterday, we tested over 302 in the rain and the wind. Today, I know we're still going till 4 o'clock, and when I talked to them about 2 o'clock, they were already over 300 that we have tested. So it's been very, very busy. I do want to say, give the list of the other testing sites that we have. We just received notice that we're going to have test sites on Tuesday and Thursday this week, and I'll finalize those test sites tomorrow. And again, those will be available on the EMA website as well as the St. Clair County Health Department website. But Tuesday and Thursday, the 17th and 19th, we'll be testing this week in St. Clair County. Next weekend, Saturday, November 21st, from 8 to 4, we'll have a drive-through clinic at St. Clair Church in O'Fallon, Illinois. And then on Sunday, November 22nd, we'll be at the New Life Church on the Troy O'Fallon Road. And then also on Tuesday and Wednesday, November 24th and 25th, right before Thanksgiving, we'll have a drive-through clinic both days from 8 to 4 at SWIC, Southwestern Illinois College. That's a drive-through only this time. So several of those, and again, check those out on our website, NEMA's website, for those test sites and the ones that we're going to have this week, Tuesday and Thursday. Just one more thing real quick. Again, today we had huge huge crowds at Belleville West, and I want to give a shout out to some last-minute volunteers who helped us out down there with everything. I want to give a shout out to Jenny Meyer and Lisa Phillipson, who came out within half an hour notice and just hopped out there and helped us out, so we appreciate that. And with that, I'll turn it over to Chairman Kern.
Thank you, Barb. So we'll go into the zip code report. Remember, these are changes, COVID positive changes in these particular zip codes in St. Clair County. We'll start today with 62201, up 5 to 335. 62203, up 4 to 337. 62205, up 3 to 295. 62206, up 6 to 600. 62207, up 1 to 323. 62208, up 5 to 665. 62220, up 11 to 840. 62221, up 14 to 1,069. 62223, up 11 to 739. 62225, up 3 to 64. 62226, up 12 to 1,232. 62232, up 7 to 319. 62240, up 2 to 60. 62243, up 7 to 225. 62254, up 3 to 380. 62257, up 1 to 80. 62258, up 11 to 381. 62260, up 6 to 272. 62264 is up 1 to 132. 62269, up 16 to 1,050. 62285, up 2 to 232. And 62289, up 1 to 16. As Barb said, we've got 145 new positives today, 975 people tested. That brings our daily county positivity to 14.9%, way above where it needs to be. I mean, for a long time, we were 6.5% and lower. So this number really shows that we have moved in the wrong direction, and we've got to get back to where we were. Private gatherings are an issue. That's where many people are contracting this virus. People seem to think that when they're amongst their friends, that they don't have to wear a mask, don't have to wash their hands, don't have to watch that 6-foot distance. But really, if these people aren't in your day-to-day bubble, if they're not in the people who live in your house with you, you've really got to mask up and encourage them to do the same thing if we're going to keep this spread down. Our 7-day rolling average, 15%, pretty close to the county positivity, way out of whack. Regional positivity, according to the state, is up today to 15.3%, and that's derived by the fact that Bond County's at 10%, Clinton at 9.5%, Madison's at 13.1%, Monroe's at 11.4%, Randolph 6.1%, St. Clair's at 13.1%, and Washington County's at 32.6%. So Herb, today's question answer day. Hospitalizations are way up. We've never seen 91. I don't think we've ever been in the 90s before. It's just and regional hospitalizations over 200.
200, haven't saw those either, and the ventilators is something that we're watching closely with the hospital administrators. As you know, as we talked the other day, you can turn on any of the news channels and hear the cry for people to get this under control.
BJC has now ceased, my understanding, elective procedures, or at least they've set the last date they'll be doing elective procedures for a while, and that's because of capacity issues. With the flu season now here, they are really worried about beds. So get that flu shot. That is one thing that is available, some way to get out there and be proactive. And of course, wearing the mask, washing the hands, and watching the social distance, all proactive ways to keep COVID out of your life.
Well, and we talked about it yesterday, you know, it's one thing to have bed capacity, but the staffing is the other part of that problem they're having. And I'm sure Barb can tell you, you know, she was telling us this prior to coming on the briefing today that, the staffing is an issue everywhere. And so it's about being prepared, and that's what the hospitals are trying to do. The other number that is really alarming is, under the age of 40, 71 of them, those cases today. So again, the spread is just all over the demographics of the age. So
as worn out as we all feel, and I'm talking about Team St. Clair and everyone out there, tired of COVID, think about the people who've been working, 7 days a week with this on their minds, 24 hours a day. We're on day 247. Our healthcare workers are frontline workers. They're all worn out, but yet they're pitching in, the adrenaline's flowing, and they're going to make sure that they follow this through. But it becomes easier for them to follow through with the COVID fight if they get cooperation from the community. And that would slow the general spread of COVID-19 and would make their job easier, or at least as easy as possible. That's really what we owe them. We owe it to our healthcare workers to wear these masks, to watch the social distance and wash our hands.
Well, I think the other thing that's worth mentioning is there's a lot that goes on behind the scenes. Barb and Sam talk all the time about the testing. We push the testing, but the paperwork, then when it gets sent over here to the EMA office, the staff here is making sure that our first responders get that notification out there to where if they're having to respond to those addresses and things of that. So it's a lot more than just coming on here and doing this briefing for 15 or 20 minutes and what the health department's doing. They're answering the phones right and left over there, fielding a lot of questions and trying to get the information out to the people, accurate information, because that's what we started and that's what we've been trying to do. So as you said, today is the question and answer session. Brian is here, and Brian, if you would, let's go ahead and see what we can answer.
Okay, we'll start with the health department questions today. Barb, the first person asked, I'd like to get tested, but I'm concerned I might get COVID from a tester since they're exposed to so many people. Is there some type of routine testing for them?
Each business, as far as Department of Public Health and our Southern Illinois Healthcare Foundation, has their own policies for their own staff. I know that they are temperature checked and symptom checked every single day. As far as specifically how often they're tested, I am not sure. However, the safety precautions are there. You'll notice we have a lot of drive-through clinics. The individuals that are testing you wear proper PPE, gloves, gowns, as well as they do as much touchless type of contact with each individual as possible. And again, to be considered a contact in the event, let's say people can be asymptomatic, there with this limited amount of time that you're actually with a tester, to be a contact is less than 6 feet for more than 15 minutes. And again, if you've been through any of these drive-through clinics, they're very fast. A lot of them are drive-through that you stay in your car and they hand you the testing equipment in a container that you grab yourself and do the testing, or if they do the testing for you, it's very brief amount of time that you're exposed.
Okay, thank you. The next person says, if a member of your family gets tested, does everyone in the family have to quarantine until your results come back? Thank you for your continued daily updates. They are much appreciated.
That's a good question. Ultimately, if you feel you're going to get tested either because you're symptomatic or you feel you've been exposed, we recommend that everyone in the household be quarantined until you know the test results. And I know that's hard because people have to work and go to school. If you feel that there's a reason you might be positive, have everyone quarantined. If you're going for routine tests, again, even within your own household, just take those extra precautions of washing your hands and not sharing towels, using paper towels like for wiping your hands after you wash your hands in the restroom in your own home. That's very helpful instead of using a common hand towel. Things like that can be very helpful. So again, if you feel you've been exposed or you're having symptoms, everyone in the household should quarantine and err on the side of caution.
Okay. The next person wrote, how long can asymptomatic individuals actively spread the virus? Is it 14 days? And additionally, what is the likelihood that an asymptomatic individual would not spread it to other members of their household, such as their spouse?
So the 14 days is measured from the time you've been in contact with a positive individual. So it takes up to 14 days for that virus to become in your system that you would develop illness. So that's why we quarantine for 14 days. And you may or may not get sick, depends on your exposure. If you finish your 14 days of quarantine, the 15th day, it's possible you could go out and be re-exposed to another positive case, and now for the next 14 days, you could be positive. So the 14 days for contacts that are quarantined is for each exposure time. So that's how long it takes for the virus to be developed in the individual. But every time you may have been exposed, it restarts the clock on that 14 days. The second part of that question, likelihood that a symptomatic individual would not spread to other members of a household. If you're symptomatic, there's a good chance you'll spread it to everybody else in your household unless you can completely separate yourself, don't share bedrooms, don't share restrooms. If you have the capability of living upstairs, downstairs, or other ends of the house. But the virus is very easy to spread. So the likelihood, again, that's why we quarantine. If someone in a house is positive, that's why we quarantine in the rest of the household contacts.
Okay. And the next person says, the health department director was quoted in the paper saying the vaccine procedure will run smoothly. I know 2 people with medical backgrounds that applied for contact tracer positions and did not get hired. How will a major vaccine project be run smoothly if they can't or won't hire a qualified individual? Are they in need of contact tracers?
I'll start with the last. Yes, we are in need of contact tracers, especially full-time. Right now, as of this date, we have 33 staff members that are acting as contact tracers, and we have 6 more in the process of being hired for a total of 39. Our numbers have quadrupled in the last 2 weeks, as we reported here every week. The holidays are coming. People are tired. As we said, we're working 7 days a week, and we're trying to give some time off to contact tracers that have been here since the 1st of February. So yes, we will be hiring more. Contact tracers, minimum qualifications are an associate's degree, and some medical background is very helpful. And obviously those interpersonal skills to be able to talk to individuals on the phone, as well as be a resource for them for numerous other issues that they may have. We are working on plans for vaccine clinics. We've done this in the past with H1N1 and working not only the health department giving out, working on vaccine clinics for the general public, the community is as well through pharmacies. We have MOU agreements with other health-related agencies like Visiting Nurse Association or hospice groups that have nursing staff. It will be very challenging because the vaccine, what we know, the ones that seem to be going to be released the earliest, it's a 2-dose process, so you need 2 shots. The second shot needs to be within 21 to 28 days, and you have to ensure it's from the same pharmaceutical company, that's the same brand of vaccine. So the details for the documentation for that is very, very important. Timing for those individuals, knowing which vaccine is being distributed at each of those clinics so we have the right individuals going to the right clinics will be very labor intensive. So as we move forward, we'll be needing more staff to help us out, and we're looking to a lot of the community partners also to help us get the vaccine as we receive it. And we won't get all, St. Clair County is about 270,000 people. We won't get all the vaccine all in at one time. We will get lots of the vaccine in, and that will be prioritized by CDC and IDPH of what groups of the population can receive the vaccine, because there'll be limited supplies as it rolls out. So as Chairman Kern talked about, those primary folks, the medical providers that have been working so hard, that are frontline, those individuals that are ill or those high vulnerable populations, they'll be priority folks just like we did with H1N1 and have access to the vaccine first per those CDC and IDPH guidelines. So will we need a lot of help? Absolutely. Do we want it to run smoothly? Absolutely. Do we have a lot of work to do? Yes, we do. If you're interested in becoming a contact tracer, please, on our website, St. Clair County Health Department, on our website, there's a spot to say, hey, if you're interested, you meet the minimum qualifications, send your resume into the health department, and we are looking for more staff.
Okay. The next one says, can someone please report how many flu cases are reported compared to COVID cases?
It's unusual it's not unusual. We can't necessarily compare them one-on-one. COVID is being tracked per person per case that's either negative or positive. With the flu isn't a mandated reportable disease. COVID is. So we know the exact numbers for COVID. For the flu, what IDPH has set up, and this is nationwide, is we have hospitals that treat flu patients that are considered sentinel hospitals, that they report how many cases they have to get a pulse of flu in the community. So it's not an exact number of how many cases of flu we have in our county that we can compare it right and left with COVID, but we have a general idea. Again, as Chairman Curtin said earlier, one of the things we can do best to help ourselves is to get the flu shot along with the 3 Ws, because you sure don't want to be, have the COVID and the flu on top of it and really stress out your body. So again, we highly encourage folks to get their flu shots as well.
And is there somewhere that they can go to see that data that you talked about from those specific hospitals? Does IDPH release that? Or?
Yes, Department of Public Health has a general population of from the sentinel sites of what the flu rates are looking like within your community.
Okay. All right, the next person says, does the hospitalization numbers include those that are on the ventilators?
Yes, they do. So like today, when we reported, we had in St. Clair County 91 COVID-related patients in St. Clair County hospitals, and 6 were on ventilators. Those 6 are counted in the 91, and the same as for the region.
And a question we get related to that all the time is there's other people in hospitals on ventilators other than those 6. Those 6 are ones with COVID-like illness that are on ventilators. So people often ask, so is everybody on a ventilator considered COVID? Well, no, that's not the case. The 6 that are reported are confirmed COVID.
That is correct. And let's say you go into the hospital for something other than COVID, and while you're in the hospital, you are identified as a COVID, that you test positive for COVID, then you're also included in that case count for the day, be it a patient and or if you then end up, and hope and pray you don't, on a ventilator.
Okay, very good, thank you. The next person says, when will the school outbreaks be listed like they stated was going to start?
Again, we follow IDPH guidelines on reporting, just like we do for long-term care and congregate settings. Schools and congregate settings are 2 different situations as far as reporting outbreaks. It's easier to identify an outbreak within a long-term care or congregate setting because those individuals don't leave that facility. Or at schools, the students and the teachers and the employees are at the school that day, but they leave at night, and it's hard to correlate if 2 kids in the 1st grade and 2 kids in the 6th grade and 2 teachers are all related. But we do our background with our epidemiology and our contact tracing to see if you may have 6 cases in a school, but you need to have those individuals epidemiologically linked, that they were all, let's say they were all at a party together, they were all at Thanksgiving together, then we have an epi-linked situation. But again, just because a school may have 10 cases of COVID, they may not all be related. So again, by IDPH's definition, they have to be 5 epidemiologically related cases of COVID to be considered an outbreak. So at this time, we've seen, again, as everywhere else, the number of cases in schools going up, the number of isolations, the number of quarantine numbers going up. But at this point in time, we have not received guidance from IDPH to list schools as outbreaks.
So who makes that epidemiological determination?
As we do our contact tracing, we see who they've been in contact with within the last 48 hours, either from symptoms or from their testing. And so as contact tracers, that's how we put the pieces of the puzzle together to say who may be related. So we ask who you've been in contact with to each of the, let's say, those 6 people. And if those 6 people identify each other, then we have a central repository or central point that they may be associated with an outbreak.
And just because I interrupted, how is the flu looking in St. Clair County? Or do we have a significant amount of flu that is here?
Thus far, the numbers that I've seen isn't, quote, too bad yet. But again, make sure everybody gets their flu shots, and they're available. Flu shots are available just about anywhere. You know, you can go to the grocery store, the pharmacy, your private provider, doctor, medical provider. So please get your flu shots. That'll be very helpful.
Okay. Now the next person says, what is the most reliable form of COVID-19 testing? Nasal swab, throat swab, or blood test?
Well, there's essentially, those are the methodologies for getting tested for COVID, but the type of test they use, one's considered a PCR, which is the ones they have to send, to the lab, and it's a much more detailed, much more efficient and effective. The efficacy meaning how good of a test it is much higher, because it's a much more complex type of test. So you can either get a PCR test or you can get an antigen test. Both of them you may get by nasal swab or by throat swab. But the PCR test is for negative and positives. It's much more effective and reliable type of test. A lot of the rapid tests are called antigen tests. And for the antigen test that test positive, you can rely, if it tests positive on a rapid test, you're positive. If you test negative, the guidance from IDPH and CDC, it could be a false negative, that they recommend you follow that up with a PCR test to make sure that you are negative. But on the antigen test, if you're positive, you're positive. On the PCR test, negative and positive have proven to be very, very reliable tests. On the antigen negative, it's recommended to be followed up with a PCR test.
Okay. Now the next person asks, are local hospitals giving plasma? And if so, where are they collecting it from?
I do not know what the hospitals are doing as far as their treatment of the individuals. I'd check with the hospital and or the Red Cross to see if they're doing any of this collection at this time.
Okay, and the last one here says, can St. Clair County create a frequently asked question page where it lists known test sites, answers to some of the most common questions such as quarantine, isolation, symptoms, restrictions, etc.?
Absolutely, we have that already. Again, on both the St. Clair County EMA site and the St. Clair County Health Department site, we list all the test sites that are coming up here in the near future. We have the website also for Department of Public Health has their own frequently asked questions section as well as links to CDC. On our website, we have links to IDPH and CDC, and we rely on their information because it's the most up-to-date. They have frequently asked questions, and there's a plethora of information about COVID. So again, going to the Department of Public Health, it's dph.illinois.gov, cdc.gov, as well as our EMA website, which you can see here, and the Health Department's website at health.st-clair.il.us. And I'm sure Randy or Brian will post those websites to show where they're available. And right on the front page of the website shows all the upcoming test sites and those links to IDPH and CDC.
Okay. Thank you very much. Chairman Kern, a couple that have come in, lots of questions about mitigations and what's happening and when it's happening. The first person says, why are the mitigations for our region being delayed? Is there an explanation from IDPH for this?
So I don't know of any delay. The Illinois Department of Public Health monitors the numbers every day, and we talk about these numbers every day. And at the point that those metrics reach reach their desk and they feel that it requires more mitigations, they will. They normally give us a few days' notice, and then they'll put those mitigations in place. So I don't know that there's any delay going on. We're currently under mitigations that have closed down inside dining, those type of things, and we'll just continue to do that. If the numbers continue to go the way they're going, though, I would suspect that additional mitigations are going to be put into place.
Okay, the next person says, when will we halt unnecessary personal services like massage therapy?
So I don't know that massage therapy is unnecessary. A lot of people that it has true health benefits for them. And the Illinois Department of Public Health has put rules forth for personal services like that, rules to follow to make your visit to that therapist safe. So it requires masks and sanitizing and all sorts of things. So Department of Public Health really has taken a look at all those services and has designed ways for those services to be able to be delivered in a safe way, a way that is going to contain the spread of COVID-19.
Okay. The next person says, why is it the sheriff's department isn't enforcing the rules pertaining to the bars? Most local departments are flat out refusing to do so. Shouldn't the county be doing it if they aren't? Says, shouldn't the county be doing it if they aren't, if this virus is so dangerous?
So enforcement is up to all of us, really, and we appreciate the information that we get here daily at the EMA office. Barb and the health department, they're going out, they're sending letters, they're counseling establishments to make sure they know the rules and are following the rules. Sheriff's Department is out also writing up reports. I reviewed reports this morning. The main goal is to try to get people to comply, to realize that these numbers are growing, and if we're going to contain the spread, we have to contain it in our total community and certainly where the spread is taking place. If there are establishments that are openly defying and continue to defy even after multiple warnings, then the action will be taken and likely is going to be taken in a couple of instances because we've got to enforce the rules that are put down in front of us. I will say that your local mayor is responsible for the establishments in their community. They hold the licenses for the liquor establishments. In the county, we hold the licenses for those in the unincorporated area, and those areas will be dealt with. But the health department is writing up warnings and violation notices to establishments, and we're going to continue to do that to seek compliance with the executive order. But it isn't designed to be punitive. We're doing this because we need people to comply. It's evident that the spread is growing, and we've got to contain the spread.
Okay. The next person says, what is the honest likelihood that a statewide stay-at-home order could be put in place? And when would we anticipate such type of decision being made?
So the governor called me on Friday, very concerned about the numbers here in our region. And frankly, I think they're concerned statewide with the way the numbers have grown. So I know that this is on everyone's radar screen, that when our 7-day rolling average gets above 15%, certainly that is an issue. And in the region, we've got to control our spread. We have to do it statewide also. I would say that if this has been handled on a national level, things would be far more effective. So if you look at the states that are really in outbreak status, they're all the states that surround Illinois. We've got Missouri, where many of our residents work and where many of us frequent. Their numbers are high and growing. They're extremely concerned about capacities in their medical facilities. If we could all do this on a countrywide basis instead of having a state by state patchwork quilt, if you will, I think it would be far more effective. But unfortunately, we're not getting that right now. So we'll wait for leadership from the governor's office, from the Illinois Department of Public Health, to tell us how things are going to be happening on a statewide basis. But I would suspect if these numbers continue to grow like this, and we're headed into a holiday weekend where there are going to be gatherings and people are going to be tempted to get together with friends and family, and many won't comply with masks or washing their hands or watching their social distance. And if at a time where we are at a peak with COVID-19, we move into a holiday weekend, it's going to be devastating to the numbers. If we think they're high now, if people don't comply with what they're being asked to do, the 3 W's, and keep those gatherings down, really only meet with people that you really have to, it's going to be a real problem, and hopefully our medical facilities can handle those numbers. But there is great fear out there that there are going to be problems if people don't comply with the requests.
Okay. The last one here, Chairman, says, who is actually responsible for the enforcement of mitigations?
So it's really local officials that are responsible, but statewide, there are, you have everything from the State Liquor Commission to the state police. The Illinois State Police, they certainly are responsible. The local health departments are responsible. Local officials, from mayors to county executives and county chairmen, we're all responsible. And so your government officials really are the ones that are out there that are required to enforce this. Some do. We do. Some don't. And really that is the issue, is when people don't comply and people aren't made to comply, you have numbers that grow like they are today.
Okay. Thank you. Director Simmons, one question that came in here on a school front, and we've talked about this several times, but this person asked, is Belleville West or East on the brink of shutting down if Illinois issues a stay-at-home order?
Well, that would depend on what that order would be. And again, I think it's worth saying that, each of the school districts have their own plan. If you remember back when we had all the school officials in, the superintendents and the principals, and they came up working with the health department. Each of them developed their own individual plans, and some of them we have seen, because of different cases, have readjusted them. And I think that will be a decision once there's a determination made. I don't have the answer to that, other than we're waiting to hear also if there's going to be further mitigations.
Okay. And one last person just put a comment in that says, thank you to the health department staff and EMA staff, along with Chairman Kern. The information daily has helped tremendously understand what we are all going through. Our thoughts go out to each and every one of you and those that have been affected by this virus. Keep up the good work.
Well, thank you for that, and we appreciate all the questions on Sunday. We hope we answered all of them that come in. We try to get to each and every one of them. If not, we'll do it throughout the evening. Some of them came in after the portal closed today, but we really appreciate you tuning in, spreading the word. Day 247, I think it was a good dialogue. Barb, thanks for that information. As I said earlier, there's a lot goes on behind the scenes other than today. It's been a little bit longer briefing, but we wanted to answer those questions. So we've got to continue. As the chairman said, we've got to get these numbers down. Tomorrow, we'll see if we get a call from IDPH, and if so, we'll let you know. Everybody have a good evening. We'll be back shortly with Cindy and Daisy to translate this into our Spanish communities. Thank you.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together,